Good afternoon. My name's Olivia. I am known as Olivia Kate on Facebook, Ollie Kate on Instagram, and Mormium9000 on Reddit. So I cover nursing related materials, that's including materials for the NCLEX. So I have a playlist with the fundamentals, things that are essential for the fundamentals, pharmacology, and I'm working on this one currently, and there's a med list up right now. So that's for med surge, comparing the two diagnoses that you will see on your NGN style questions and case studies. So I also want to start getting into med surge really soon. I mean, not med surge, maternity soon, because I know for me, when I was in nursing school, I had a hard time with maternity, and I want to make it easier for people to grasp the concepts and learn. I know I look a little different today, don't I? Yes, I decided to go pink. Is really cool. Anyways, so besides the point, I also have a tease playlist. I know the videos are old, but it should still be able to be helpful if you're trying to pass the tease exam, and it will help you with studying. And you get bored with my nursing related videos, there I have a whole playlist of documentaries, starting with like the Bright Eye thing. I forgot the name of the caterpillar. And then there's variety of ones to watch. I have opinion pieces. And then I also cover reality TV shows. I have a whole Love is Blind playlist of my reactions, and I'm not going to watch the next season. I'm just going to watch the reactions and kind of see, just because I'm not in the mood to deal with the drama anymore, and I'm just kind of over it, and it's kind of gimmicky now. And that's about it. So I'm going, you all know, I work at the methadone clinic, so I'll barely have much time to be recording videos left and right. So I wanted to cover shock. And for all nurses, whether you're an LPN or RN, and if you're especially in a hospital setting, it's very important for you to understand the concept of shock, because it's a life-threatening condition, because your body's overwhelmed and the body's not getting enough blood flow. So shocks are caused by different reasons. So we're going to go through all those five. There's five to know, and we're going to go over that, and then the conventions on what to do for each of them. Okay, so let's get started with this. So there's 5 different shocks. So I almost said 4, but there's one that is often overlooked, so I'm going to talk about it. There's 5 different shocks on the NCLEX that you should be aware of, or your Q banks will ask. Because sometimes, like I said, the NCLEX can ask you different array questions, and you don't know where you can study from. It's just a good idea to kind of have a broad understanding of different subjects, so that way when it's asked, you're prepared. Okay. It's very important for you to understand shock, because like I said, I can't talk sometimes. Because like I said, shock is life-threatening, and like I say all the time, you don't want to be delaying treatment. Okay, so here are the 5 that you're going to need to know: septic shock, hypovolemic shock, cardiogenic shock, neurogenic shock, and anaphylaxis shock. Yes, anaphylaxis can be as a form of shock, because that's basically what it is. Okay, and we're going to talk about it again during our next lecture regarding the blood transfusions. So yes, and that's probably going to be mostly RNs that are going to need to know that part. Okay, the most common shocks that I think is commonly seen, don't mind the dry hands, hand washing all the time. But yeah, the common shocks you will end up seeing will be sepsis and anaphylaxis shock, because that happens a lot, and people are allergic to common things, and sometimes if not treated, shock happens out of nowhere. Then sepsis, people are often getting infections all the time. So those are the most common ones you will see. So I'm going to start with sepsis. Okay. Sepsis is one of the common ones, okay? And when I tell you to star and underline, I mean, all of them are star and underline, but when I say highlight, this is going to be very important. You want to do that, okay? So sepsis or septic shock. The cause is severe infection. So that's mostly your bacterial infections that you'll see, but you can also have sepsis from horrible viral infection, but you'll mostly see, again, bacterial. The heart rate's tachycardic, of course, because the body's compensating because it's losing all that fluid and volume, and the body's very overwhelmed. The skin's going to be warm, and highlight this piece, okay? So when you're going to see in a case scenario, okay, this person has an infection, so you're going to want to look for the labs. So you're going to want to pay attention to RBC if it's over 10,000, okay? Because that means that they're really infected. The temp's going to be like over 100 and 200, 300, 4 because the temp's going to be elevated. And then another thing is also pay attention to the lactate because they'll be elevated. So that means this patient's septic and you need to act fast, okay? So highlight that piece if you didn't understand what I just said. Highlight what I just said. Infection, temp elevated, lactate is elevated as well. Highlight. So the treatments would be IV fluid, and that's really standard for all the shocks. But you want to do IV fluid. You're going to use antibiotic, and it's going to be broad spectrum. So remember, we were learning about the broad and narrow spectrum for antibiotics. You're going to want broad because we want to be able to fight off the infection that's going on in the body. Okay, you want to find out what's going on there. Vasopressor, and it's important because so this is going to be recurring to the vasopressor because it's constricting the blood vessels. Why? Because the blood pressure is going to be low. So again, when the body's compensating, the heart rate is high. The blood pressure is going to be pretty low. So it's trying to compensate. And because you're losing some of that fluid, we're going to talk about that once we get to the hypovolemic piece. We want that blood pressure to increase so there's more blood flow going on to the body. Okay, so that's what you're going to do. Now, speaking of hypovolemic shock, loss of blood, loss of fluid. So you'll probably see this with a person who's losing blood, like through gunshot or violent attack, like knife stab wounds. Or for some reason they're losing blood somewhere in the body, like lots and lots of it. Okay, so again, what I was just saying, they're going to be tachycardic because the body is compensating, right? The skin this time, instead of it being warm like sepsis shock, it's going to be cool, pale, and clammy skin. So highlight this piece as well. Low blood pressure, high heart rate. So those are your key words to know that this person is going through hypovolemic shock. So the treatment is IV. So when I'm saying IV fluids, normal saline, okay? Normal saline is what you're going to see. And blood transfusion. So we're going to go over blood transfusion next week. I'm not going to go over this week because I have work this week, so I won't have a lot of time to record. So we're going to do blood transfusion. So the important thing I need you to know whenever you're asking you about a blood transfusion, you need to verify the blood type. It's very important because if you do not, you're asking for a lawsuit. Okay, do not fuck with that. Sorry, I know I hardly swear, but I'm dead serious because I saw a question about how they had a CNA verify. I'm like, it's supposed to be 2 RNs, okay? 2 RNs doing that, but we'll cover that the next video. But just always verify. That's a side note. Okay. Now, cardiogenic. It's because, again, this is kind of common if someone's going through a heart attack or they have heart failure, and it gets very complex. So it's due to heart pump failure, which you're going to often see with heart attacks. Or in other words, myocardial infarction, which we just talked about last lecture. Heart rate, again, tachycardic, high. Skin is cool. So you're going to notice crackles. This person's going to have chest pain because that's a classic symptom of what's called a heart attack, chest pain. Low blood pressure, body's compensating. So the priority is oxygen with this patient. Make sure to have oxygen right there. They need vasopressor. Again, constrict the blood vessels, and then it's going to increase the heart rate. IV fluid, normal saline, because the goal is to return cardiac function to the heart. So again, don't delay treatments with any of these, okay? Next one, neurogenic shock. So this one I hardly hear about. This is rare. So that's why I'm telling you this. You would mostly see this if someone had like spinal cord injury, which I don't work in a hospital, so what do I know? But it's commonly, that's what you'll commonly see with these patients, okay? So the cause of spinal cord injury over T6. So just a quick brief review. Cervical is from C1 to C7. Because, right, 7, 12, and 5. So you want to be careful with anyone that has any cervical injury. Just a side note. And then thoracic. So you have 12 because, again, 7, 12, and 5. I've learned this a long time ago. So T6 would be somewhere between, I want to say, before you get to the lumbar piece. I'm trying to remember because it's been a while, but anything above that, yes, that's the cause of it, okay? So unlike the other shocks, this person is bradycardic. And when I say bradycardic, they have a low heart rate. So below 60. The temperature is going to be warm, unlike the other ones. Okay? Sorry, just ate. So this is the only shock you're going to see with bradycardia, not with the rest. So please highlight this, what I just said. Only shock that you're going to see with bradycardia. And I want you to also monitor for autonomic dysplexia, which I'm going to talk about in a separate short one day. Okay, so check for the blood pressure as well. Check for any, I'll go over that in a short next time. So the treatment here, I can't talk sometimes, Jesus Christ. Immobilization, okay, that's what I meant to say. So you need to be using cervical collar, backboards, because you want to keep the person immobilized and straight. So you're going to do the log roll and stuff. IV fluid and vasopressor, again, to increase the blood pressure, and normal saline for this. All right, so this is the most important one I want you to know. Okay, anaphylaxis shock. So I know most people don't see it as shock, but it is, okay? It really is. So this is someone that will have a severe allergic reaction. That's a cause. Heart rate high. The temperature, the skin's going to be flushed. And then wheezing, highlight the next few things I'm going to say. Wheezing is noted. The moment you hear wheezing, you see some swelling up there on the airway, you need to act like now, okay? Because anytime you see airway being compromised, you do not delay treatment at all. You do not. So the treatment here would be epinephrine first. Because why? It's going to open up the airway. It's going to open it up. Never, ever delay treatment. Never, ever delay treatment. And then I think the next thing would be the IV fluid. And the goal is to obviously stabilize and establish an airway before you do the rest, okay? And that's it for the shocks. So I was happy to do this lecture because shock is super important, and it's often slept on, and it should not be. You will often see these on your Q banks and whatnot. So it's important for you to know. All right. So I have an additional source that's by Simple Nursing. He does an even better job than me explaining the shocks. So I'll leave that there. And you'll also have my platforms and links to follow me. You have any more nursing related questions for me, like NCLEX, or just tips and stuff going through nursing school, like your exits and your entrance exams, just let me know. I'm one message away. Okay, so I'm going to cover the crash, because the reason I want to put it off for so long, just because so many people are covering it, and I don't typically go through true crime. My God, why can't I speak today? Because there's so many true crime channels for you to choose from, and they cover, and there's not one channel or one TV channel work doesn't cover true crime. So I will go over it just because it's getting a buzz. I was going to cover something else, but we'll go over those. And I'll go over stable versus unstable this week as well. Anyways, take care and have a good day. Bye.